Hi, my name's Karina. I'm going to be your nurse for today, and today I'm going to be performing a cardiovascular and peripheral vascular assessment on you. Is that all right? Yes? Okay. So then I would perform my hand hygiene. I would clean my stethoscope with an alcohol wipe and begin by inspecting and palpating the vessels of the neck. So here I'm looking for any signs of JVD, which I'm not seeing on either side. And now I would ask her to lay down for me. And I would palpate the carotid arteries one at a time. Okay, I'm not feeling any abnormalities on either side. And now I'm going to be auscultating with both the diaphragm and the bell. I'm not hearing any turbulent sounds or brutes on her right side. And I'm not hearing any brutes or turbulent sounds on her left side as well. So everything seems to be pretty good. And now I'm going to inspect the chest. Can you sit up for me? So because she has a shirt on, I'm not really able to see any abnormalities and pulsations, but she doesn't seem to have any irregularities as far as the chest goes. I'm gonna start by auscultating the pulmonic, which would be in the second intercostal space. So here's the first one, here's the second one. I'm sorry, this was the aortic. The pulmonic is to the left of the sternum. The aortic was to the right of the sternum. I'm not hearing any abnormalities. And then I would move over to the tricuspid, which is just to the left of the sternum. I can hear for S1 and S2 in all of the valves I just checked. And then right just under the breast is where the mitral valve is found, and I can hear S1 and S2 with no extra heart sounds. Okay, so I was able to hear S1 and S2 in all of the extremities. I didn't hear any extra heart sounds or any abnormalities, such as a murmur or any abnormality. And then I would I would auscultate the heart while palpating the radial artery. No, I would inspect the skin for temperature on the arms. So if I can raise your, let me see. I can feel through her shirt. Her temperature is equal bilaterally. I would do it with the back of the hand. And then I would inspect her radial pulses. Which are equal bilaterally. I would check her brachial. Extend your arms, please. Which are also equal bilaterally. Yep, they're equal in terms of rate and rhythm. And now I would auscultate the heart while palpating the radial artery, just to see if they are equal in terms of rhythm. They are equal in terms of rate and rhythm. Okay, and now I'm going to be inspecting and palpating for color in the skin on the lower extremities. So if I could have you lay down and lift your body up more, like in the bed, just so I can show your legs on the screen. Or I'll lift her legs. I would inspect the temperature, which is equal bilaterally. It is equally warm bilaterally. And now I would inspect for any presence of edema, which I would do by pressing against the skin. And as I press on the skin, I'm noticing that it comes right back up. I'm not seeing any crevices or any abnormalities that would be present with edema. So her skin is good. And now I would palpate the post-tibial and pedal pulses bilaterally. So I'm gonna have to take off your socks for this. Raise them a little more. Okay, the pedal pulses are equal bilaterally. And so are the post-tibial. Now I'm going to check for a capillary refill. And since she is not wearing any nail polish, I can check by pressing against the nail. And it is filled in less than 3 seconds. And I would have also done so on the fingers, so if I can see your fingers. They, again, fill in less than 3 seconds. And that concludes the cardiovascular and peripheral vascular assessment.